Ka Executive Committee jong ka FERNDALE Apartment Society kala thaw ka COVID-19 Response Task Force na ka bynta ban iakhun pyrshah ka khlam COVID-19. Kani ka society ka badan kumba spa shipotali ki longiing ban rius pa ngut ki nongsah haduh mynta kala don arpinyo ngut ki bayo ka jingpang COVID-19. Ki barang don mynta hapdeng ka jingsumar ki don shipongut prangut ki basumar haiyeng bat arngut a hospital. Ubijoy Sangma, Nodal Officer Jokanika Task Force, Ulaitu Banakaliang Society, Kapershang Banyarap Naladi, Yaki Basa, Hakanika Society, Hakabakanika Task Force, Kayetre Rinkat Lang Bakasorkar, Bakatana Koikakia.
We are preparing people through awareness building, through information sharing, by helping to monitor their health, those who are detected to be COVID-19 positive patients, and also helping them by providing the moral support that is required, physical support that is required. They want any items, food or any groceries or anything, that our volunteers, we will help them. And we also always call them and ask how is their health situation and all. And if the situation deteriorates, that needs to be hospitalized, we will coordinate with the government authorities and 108, and we will help them in making their transportation and all whenever there is a need.
Ulai thuru bagladap thiri ki cylinder oxygen concentrator bar kiwe ki jingdan kam yo kumno ka don ka jingdan kam ka bakar ke. Ulai jing modri ki Shnong ki thawan pershang kumi kini ki lat khanang ban Iarap bat pendunai ki jingkit jong ka sarkar jala.
So we are trying to show as a model to inspire others. If somebody wants, we will be very glad to advise them, we will be very glad to help them, because this is the need of the time. We cannot depend on government alone. Government is already overburdened. Health department officials are overburdened. We need to help. Community to come in together and lessen their burden, what we can manage within ourselves.
President Barim Jokanika Society Ubadan Kupars Aim Ula Benrap Bagila Penkre Bahai La De Ban Yakun Yaganika Khlam.
We are very well prepared, given that we have experience to work together, and the fact that many of the members have reposed their trust in us, because the management is led by people who are very resourceful in many different spheres. Okay, we have doctors. Our secretary is Dr. Diganta Das. He is a medical doctor. We have Mr. Bijoy Sangma, who is a nodal officer, who heads the FERNDALE COVID Response Task Force. And then, of course, we have a large number of our very resourceful business people who always support us in every venture that we take. Now, why are we prepared? In the context of this corona, I think given that we have a large number of population here, 110 flats, close to 500 citizens here, we still have no casualty. So that is because we have put in place several measures to contain and manage the corona crisis. Coronavirus, this pandemic as such is a war. Unlike any war, we have a war room where we sit and discuss and talk and adopt several strategies and measures put in place to make sure that our members here are safe and secure.
Ulong bakum ka imlang ka sa alang ki don kam ban le bat pendap yala ka bynta.
That some localities are well managed, some localities are pathetically managed. They need to really raise the game, because corona crisis in a very twisted way has opened up our eyes that until we are organized, we are going to, a lot of people are going to suffer. So using this medium, I appeal to the people residing in Shnong and the rest of this state that get yourself organized, because that is going to save lives. And most importantly, don't expect that only the government can come to you. Government is already overstretched in the resources. So you have to depend on yourself. Okay, that is an important story. How you do it, you mobilize the resources that you have in your villages and localities. That's step number one. And then you can move forward from there.